Hello class. I thought I would put a quick video together to demonstrate how to create a treatment plan for your patient. When you are ready to treatment plan for your patient, you have already completed your initial assessment by your instructor. To create a treatment plan, you are going to make sure that you're into the patient's chart. You will see the patient's name here on the upper with the ID number behind the patient's name. You're going to want to make sure that you're in the patient's chart. And this screen is going to show up. So I'm going to go ahead and exit out of this. And your screen is going to look like this. Now, we're always going to be treatment planning some kind of an assessment, whether it's a recall assessment or a recall assessment. If the patient has never been seen at Herzing University, it will be considered an initial assessment. If the patient is a returning patient, then it would be considered a recall assessment. So where you find those is on the left side or right side, you're going to see where it kind of shows like an initial. You're going to drop down that box and you're going to choose whether it's going to be an initial assessment or a recall assessment. I'm going to choose an initial assessment because my patient has never been here before. I'm going to click on that. Then you want to make sure that the proposed is clicked on. When you hit proposed, your name, the provider, will automatically appear. So it's got proposed. I'm going to go ahead and press OK. I'm going to do oral hygiene instructions. I'm going to click on that. Make sure it's on proposed. You will see your name. I'm going to press OK. My patient is an adult, so I'm going to go ahead and treatment plan an adult prophy, which is on the upper right here. So pro, I'm going to click down here. You will see you have adolescent, adult, or child. We're going to go ahead and press click at adult. It's proposed. We're going to press OK. And then I'm going to go ahead and do fluoride. And the fluoride, I'm going to choose between tray or varnish. I'm going to go ahead and click varnish. Proposed. OK. Now you will see everything that you're proposed down here. Once you have everything proposed, you are going to click down here on the bottom, treatment plan. It's going to bring you to this screen. You are going to click on new plan and you're going to do a description. Most students will put in the date. And you will click OK. And then you're going to see everything that has been proposed. Now, I want to complete all of this treatment. Okay, so I have the date, I have what's proposed, and then I also see the fee. At this point, make sure you kind of take a look at this fee to ensure that these are the fees that have been addressed with your patient or what you're expecting. If it isn't, you want to stop at this point and you want to exit out of this and go talk to the front desk team because maybe there just needs some kind of a preference that needs to be changed. So I'm okay with this. So up here, I'm going to hit this box. You can hit this box to select all four, or you can click each individual box. Down here on the lower left, it will say you selected planned services. I'm going to click on this and it's going to bring me back to this screen. Then at this point, I'm going to hit presentation on the right side, and this presentation is going to be able to be presented to your patient. So I'm going to click yes, I want to save all plans and I want to continue. It's going to show this screen and it's going to have everything laid out of what you're recommending, what's proposed, and the fees and the total plan, what the patient has to owe. Okay, so I'm going to present this to the patient and I'm going to explain each area and then let them know that it's going to be $40 for their treatment. I'm going to go ahead on the upper right and I'm going to click to exit. I'm going to go to informed consent. Yes, I want to save this plan and I want to continue. Here you're going to see the treatment, it's proposed, And we're going to go to Auto Note. And I'm going to scroll down until I see the blue Informed Consent Narrative. I'm going to click on that and press Use. That automatically puts this in here. Then at this point, I'm going to have my patient come over, and my patient is going to sign for their treatment. We're going to accept the signature. You, as the clinician, are going to sign, and you are going to blue note your instructor, and then your instructor is going to sign. Once your instructor has signed, you should have 3 signatures: your patient, you, and your instructor. Then you are going to accept the signature, and you're going to create the consent. This screen will come up. It will have everything for the consent agreement between you and your patient, and then you can exit. Now, if you want to make sure that the treatment plan was saved in your SmartDocs, then you would go down to SmartDocs, and you will see right here that my treatment plan has been saved into SmartDocs. You can click on that, and you will see the treatment plan that you have created with your patient. I really hope that that helps. And if there's any further questions, please let me know.